For my returning subscribers, thank you very much for watching and tuning in. For my new subscribers, thank you for tuning in, sharing, subscribing, and watching this channel. Today, I have one of the biggest psychologists, the director of Restore and Renew Wellness Center. Tell me about the background, your story, and what it is up to now here at the Restore Center.
Thank you very, very much. My name is Dr. Nelly Otieno. I'm the program director at Restore and Renew Wellness Center. My journey started way back, 17 years. I was working for Postal Corporation of Kenya. I worked as a marketer with a bias to sales. But my CEO then realized that there was some potential as a helper, and therefore they sent me for a short course so that I could help professionally. So I started off with a certificate course in counseling. And after that, I realized instead of literally going to help others, I realized that I needed help more than they did. And so I requested if I could go back, and I went back and did a higher diploma in counseling again. And that was just the beginning of my story. And then from there, I went and I am where I am today because of that long journey. But Restore and Renew Wellness Center was born after a short stint of psychological support at an institution where I worked for about 4 months. Okay. And as I was doing that, my vision to helping others grew even wider, and I thought the best thing was to literally pursue my vision. And so what I did first, last year, I went to the US to just go and benchmark with a few other organizations that were doing what I thought I wanted to do. And so after coming back, then we set up, and here we are. And what we do is we give literally a whole range of mental health support in terms of counseling, psychotherapy support, and we do addiction support to those who need. We also we are a rehabilitation center. And what we do, our rehabilitation in Kenya, what I've realized a lot, when you talk about rehabilitation, is understood like you're just helping those with like a drug addiction kind of support. But our rehabilitation goes from literally supporting those with addiction cases or difficulties, especially drugs and alcohol. But we also do, like, for example, trauma support. People who've had, like, for example, somebody has had a stroke, and after the hospital, we're in between the hospital and the home. So after hospital, these people are decided to go home. But who is taking care of them at home? They've been so much dependent on support from the professionals at the hospital, and sometimes the family cannot be able to do this. People are working, others are busy, so they tend to literally get so frustrated because they don't get this kind of a support. So what we do, for us, you bring them, and in between we are able to help them until when they are ready now to support themselves. So we give like 3 to 6 months kind of help for them.
We've had your journey, how it is, and the different situations and conditions that you're working on, especially the one that you've been dealing with drug addictions and all that. Could you take us through your journey on how it has been, especially in this center?
Rose, if I may tell you, is that for me, I think the best time for me, or the greatest joy that I get, is when a client comes here, and sometimes they come when they're totally knocked off. Some come in drips, they do not even know where they are. But my greatest joy is when this person leaves our institution and they're outside there, and they can literally go back to their normal health. For example, if they're working, they can go back to work and become productive in their organizations. Right. If it's, for example, a parent who has come here, they can go back and be able to take care of their families and still be able to do their chores without any disruption. And some of them have actually been able to stop drinking completely. Some come here where they could not even get a job because of the that condition. But by the time they're getting back, we have a case that literally we took for an interview in a drip, and this person went for the interview with a nurse escorting, and they went for this interview, got the job, and right now they're working, and alcohol addiction is actually a thing in their past. So we have people that live here and can tell their story that they were helped. So for me, that is the best thing. And for sure, we get, and especially young people, drug addiction has become a menace to our society. Young people will tell you that their joy is when they drink, they are high, or they take those substances that make them go high and do things, not realizing that some of these things are also a danger to their own health. Yes. So ours is to help them so that they can be able to come to a realization that what they are doing is not beneficial, and then we support them to be able to stop this and then be able to be productive again.
Thank you very much on that about the youth and addiction and all that. Could you kindly tell us for how long is the process? How long does it take for someone to be out of the addiction?
People differ, but the reality of the matter is from about 3 months, between 3 months to 6 months, you are sure that this person is on the right direction to recovery or they're not. So the shortest period that we can be able to help an addict is 3 months, but it can actually go up to 6 months. Then after that, we do now follow-ups while they're outside. 3 months, literally, this is on, they are actually admitted. And we have a program that they have to follow for these 3 months. Then after that, assessment is done to see where they are, and we can release them. Others take up to 6 months, depending also on how long this has been in the system, for how long they've been abusing this, whatever the substance that they're abusing. Right.
Have you ever had any return cases, as in when one comes to your wellness center and then it recurs again? Have you ever had that issue, that situation?
Okay, what I can tell you, this is what we call relapse in medical terms. So what happens, yes, you would get cases of relapse. I wouldn't tell you that out of the 100%, they all go out and stop. It depends. Literally, it depends on how this person is by the time they're coming here, what is the stage they were at. That's number one. Number two, it also acceptance. Because for this program to be successful, the client has to accept. Because literally, this addiction, it's a disease, a total huge disease. And there are many, many things that, first of all, what drove them to it. So you are literally dealing with the psychological well-being of this person. And then are they ready to stop doing what they are doing, you know? So sometimes we have people that remain in denial for a very long time. And that's why for us, 3 months is the shortest period within which you can be able to work with this person. So we've actually had, like you asked, we've had cases where, yes, there's relapse. It's because also after we leave them, what is the readiness outside there, especially within the family, to accept them, because there's a lot of stigmatization when it comes to people who are already addicted. So all this, there's so much that is involved. If the whole team works together and the processes are all followed, then we've had 100% success with an individual. But if there's a breakup in between somewhere, then most of the times you'll find the person relapses.
Thank you, Nelly, for that. My viewers would like to like come back to you and to reach you for advice and to contact you. How can our viewers reach you?
We are actually based where we are. We're actually in Karen at RHINO Park, RHINO Park Close. And our telephone numbers are 0726144949, which will also give you our flyers, and you can actually share with the viewers. Then we have a Renew and Restore Wellness group of companies. We have a website, which we'll also be able to share. And so we are reachable. All our handles are also working. So we can be reached out on IG, on Facebook, on Twitter. You can actually be able to. I would tell anybody who is going through things that are related to mental health, whether it is stress, whether it is depression, whether it is addiction, postpartum traumas, that we are actually available. You can reach me on the numbers that I've actually given. You can get me on Facebook. You can also get us on IG. And it's also important that you reach out for help. Sometimes it's easier done while it is still early than wait until it pushes you to the wall. Because one of the things that depression does is actually push you to the wall where you find yourself alone and you cannot be helped. So we are actually reachable and we are ready to help where we can. You can come in. We actually have a 32-bed facility where we can admit where it's necessary, but you can also come as an outpatient. And if you go to our website, also you can book appointment. All our psychologists are on our website, so you can actually even make a choice on the person you want to see, and we'll be able to see you either in person or online.
Thank you very much for viewing. In our next episode, we'll be talking to Nelly Otieno Kituro on the mental issues. There's a lot of mental issues going on, and Nelly will take us through what it takes, what are the conditions, what are the medical implications, and what help one can get. So please tune in, share this video, like, comment, and see you in the next episode. Thank you.